of technology. Less than 25% of physicians in our country, even today, are using electronic health records. Despite the fact that we know that it improves quality of care, it improves security of records, it has been very difficult, and so we're struggling with that now. Physicians are not people who easily change. Once we get our medical education and our boards and all, getting people to change the way they do things has always been a challenge. And it's really demonstrated in the use of this technology, which we're now really pushing. In fact, we made a decision that every patient who would be seen in New Orleans, whether in a screening program or what have you, would leave with an electronic record, a thumb drive, that they can then take to wherever they were going. And we also work with many of the clinics like St. Thomas and others to train people for electronic health records. But it was not easy. People don't change that kind of behavior easy. Now, there's a very interesting discussion that goes on in our country about the problems of not having universal access to health care. Recently, President Bush, in a discussion about that, said, well, you can say what you want to, but all Americans have access to health care. And he said, because we have the public hospitals. Well, the sad thing about that, of course, is that the public hospitals in our country are really in bad shape. A lot of our emergency rooms are jam-packed, so even people who have urgent problems often can't get care. So people who rely upon the public hospital, as so many people do, are likely to find themselves waiting for long periods of time. And so people ignore health problems. You don't want to go to an emergency room and wait, 8 to 10 hours. So you wait until the pain is unbearable or the problem is life-threatening, if you go at all. And so Charity Hospital was founded 275 years ago. There's a debate about whether Charity or Bellevue is the oldest public hospital in our country. I think Bellevue may have had Charity by a few years. So this was a big hospital in New Orleans and really connected throughout the state of Louisiana. Serves 62% of New Orleans residents before Katrina, 62% served by the public hospital system. And it provided psychiatric, substance abuse, and HIV/AIDS care, all of these things, including medical detox. It is now, of course, closed with no plans to reopen, and a lot of implications in terms of health care and especially mental health care. Now, there's always this discussion about the connection between social determinants of health and health care. And because of my own bias and background in primary care, I think primary care has always seen itself as sort of that connection. When I was a medical student, there was a major commission, the Millis Commission, who was asked to really define the course of training for generalist physicians. And that's when the term primary care was first introduced in 1966. And the definition of primary care that came out of that, of course, was first contact care of the often undifferentiated patients, comprehensive care, really important continuity. That's the medical home. That's the relationship that Mike was talking about, the continuity of relationship, somebody taking responsibility, coordinating your care, keeping you informed, keeping good records, and hopefully records that cannot be washed away. But the Institute of Medicine added in 1994 that primary care is where this integration of services in the context of family and community is supposed to take place. And I think that's where we have the greatest opportunity for improvement, by taking seriously the opportunities to impact upon social determinants of health and to provide leadership in communities and helping to bring about the kind of policies that support health, whether it's in areas related to overweight and obesity or substance abuse or what have you. The need to integrate whatever services we're providing in the context. Well, I'm sure Michael yesterday, in talking about the Commission on Social Determinants of Health, pointed out that the Commission mission is to foster a global movement that places fair health, fairer distribution of health, and better overall population health at the head and hearts of governance. That's our hope. I like this quote from J.W. Lee, who appointed the commission, and many of you know that J.W. Lee, who had been at WHO for many years, mainly working with infectious diseases, when he became director, made a priority the issue of social determinants of health. And he said the goal is not an academic exercise, but to marshal scientific evidence as a lever for policy change, aiming toward practical uptake among policymakers and stakeholders in countries. There is, in fact, a gradient, not just in the United States, by education and income when it comes to health outcomes, but in many countries throughout the world. So our commitment to elimination of disparities in health has to be joined with the global commitment to the elimination of health inequities. And hopefully there are many lessons that we will learn from a tragic experience like Hurricane Katrina that will help us to really more vigorously attack social determinants of health in the future, to try to make sure that especially every child has an opportunity to develop to his or her full potentials. I'm not going to discuss the Surgeon General's prescription, but I do want to say that clearly as we look at disasters and how disasters impact different groups, how different groups respond or survive disasters, and what happens afterwards, social determinants are really key. And perhaps at no other time is it so clear how important social determinants are than when we have to deal with disasters. Now, it can be overwhelming, and I want to end with one of my favorite quotes. If any of you watched the funeral of Martin Luther King Jr., you probably remember the keynote speaker, if you will, for that funeral was Benjamin Elijah Mays. He was president of Morehouse College during the time that Martin Luther King Jr. was a student there from 44 to 48. He was also president during the time that I was a student there from 59 to 63. And he was doing the same thing then that he did when Martin Luther King was there. He came every Tuesday morning to the chapel to speak to the students. And his major message was to try to motivate us. Many of the students there, like myself, came from homes where parents had not been educated. We came basically from the fields of the South, and their goal was to convince us that we were special, that we were supposed to be leaders. So I have a lot of Benjamin Mays quotes, and let me just leave you with my favorite. Benjamin Mays said, "It must be borne in mind that the great tragedy of life is not in failing to reach all your goals. It's in having no goals for which you're reaching. It's not a calamity to die with dreams unfulfilled, but it is a calamity not to dream. It's not a disaster if you fail to achieve your highest ideals, but it's a disaster if you have no high ideas for which you're striving. It's not a disgrace to fail to reach the stars. It's a disgrace to have no stars for which you're reaching." In the final analysis, he said, and I think he's saying to us today as we take on social determinants of health, not failure, but low aim is sin. So globally, we must aim for a new kind of society in terms of health equity. And if we continue to aim for it, I think we will reach that goal. Thank you.